Hello, good morning. My name is Christine Rickel, and welcome to my presentation. I am an infectious disease epidemiologist studying out of Maine. I have recently discovered a new infectious disease called Ecoplasmosis, which comes from the bite of an infected mosquito. First, let's review screening and diagnostic testing. That way we can concentrate more on what this newly developed diagnostic test really does. First, a screening test is exercised to examine asymptomatic but at-risk individuals to classify as unlikely or likely to have a certain disease. The intention is to identify them before the onset of any symptoms. And a diagnostic test is exercised to examine symptomatic individuals to determine whether a person is free from disease or not. These medical tests are given to the individuals who show symptoms or have tested positive for the screening test. Key points to remember are that all diagnostic test outcomes can be wrong, and diagnosis does not imply certainty, but carries an implied probability. Now let's talk about ecoplasmosis. What is it, and where is it found? Ecoplasmosis is found in the northern parts of the country like Vermont and Maine. And because it is such a newly discovered disease, other parts of the country may soon be infected. This disease affects the bloodstream and has been known to cause flu-like symptoms like fever, muscle aches, as well as overall exhaustion. The Rylon test is painless and inexpensive testing compared to the only other test that may diagnose ecoplasmosis, which is an imaging test that requires intravenous dye. The chart I'm about to discuss is based off a population of 10,000 participants. Of the 10,000 participants, 8,517 tested positive for ecoplasmosis, and 1,483 tested negative for ecoplasmosis. And the 8,517 that tested positive, 1,274 had the disease, and of the 1,483 that tested negative, 1,357 did not have ecoplasmosis. In reviewing this, you may notice that we have a sensitivity of 91%, which means that 91% of individuals who have ecoplasmosis will in fact get a positive testing result. It may also mean that our newly discovered Rylon test can diagnose ecoplasmosis accurately 91% of the time. This allows for the Rylon test to only have a 9% false negative rate. Okay, let's talk about specificity. The specificity of the Rylon test is 15.8%, which means that only 15.8% of individuals who get tested for ecoplasmosis that don't have the disease will actually get a negative test result. That means that 84.2% of individuals will have a false positive test result. The positive predictive value for this study was 15%, which means that only 15% of individuals who test positive actually have ecoplasmosis. The negative predictive value is 91.5%, which means that 91.5% of participants who test negative for ecoplasmosis do not have ecoplasmosis. The Rylon test is very inexpensive and will help to save millions for hospital budgets. In review of the Rylon test, we can say that this test has a very high rate detecting when the disease is not present, allowing for those patients to feel much better. The Rylon test does have a low positive predictive value, but that means patients will have some further testing before moving on to other treatments. Thank you for listening to my presentation.